Hello everyone, my name is Mahaley Head. I'm currently a registered nurse and in the nurse practitioner program at Auburn University. The purpose of this video is to complete a head-to-toe physical assessment of my patient. In a normal setting, a normal physical exam, the patient would be in a gown, that way I could assess the skin fully, but for modesty purposes of this video, we won't be doing that. And also, the practitioner would assess bilaterally, and we may not do that every time in this video just due to time constraints. So, we'll start with the general survey. I would do hand hygiene, which I've already done, and then my patient, how she appears, her skin, her nails. She's a 23-year-old, healthy, slim, Caucasian female. She appears to be in no signs of she appears to not be in distress. Her posture is good. Her gait when she walked in, which I watched when she walked into the office, it was smooth and symmetrical. She's wearing appropriate clothing for this exam and for the weather outside. Her mood and speech was appropriate when I talked to her earlier. And personal hygiene is good, and her skin looks good as I can see. But we're going to assess her skin and nails throughout this assessment. We did her vital signs earlier. She is 5 feet 6 inches tall. She weighs 130 pounds. Her BMI is 21. Her blood pressure was 126/72. Her heart rate was 76. Her respiratory rate was 12. Her oxygen saturation was 99 on room air, and her temperature was 98.8. So, and then we'll move on to the head. So I will inspect her head first. It looks symmetrical. I don't see any masses visible. I look at her hair also. It looks evenly distributed. But then you'll palpate, so you'll feel for any tenderness. Feel anything? Any tenderness? No, I don't feel any masses or lesions either. Her health, you will also assess her hair further that way for texture, and it is evenly distributed. Then you can move on to the face. Inspect first. It looks symmetrical. No skin discolorations. You can do, or we'll do the facial movement, so cranial nerve 7. So if you'll squint your eyes really tight, I'll try to open, and I can't do that. And then, can you raise your eyebrows? Good. Can you smile? Can you frown? Can you puff out your cheeks? Good. Perfect. So then we can do her sinuses. So I don't see any bulges on inspection, and then we can palpate. So her frontal, any tenderness? No. Her maxillary, any tenderness? No. Okay, good. And then we can do her lymph nodes as well, or her teeth. We can do her lymph nodes. So preauricular, postauricular, tonsillary, occipital, submandibular or submaxillary, and submental. And then we can do cervical and supraclavicular. No enlargements there. We can do her temporomandibular joint also. It's assessing cranial nerve 5. So if you'll clench your jaw and then open and then close, no popping or clicking is heard. And from there, we can move on to your eyes. So inspection first. Her eyebrows, the hair is evenly distributed. They're symmetrical. Her eyelids, I don't see any swelling or redness. Her eyelashes, they're evenly distributed, and they're in the correct direction. And her actual eyes have appropriate alignment and position. So then we'll palpate the lower eyelid, looking at the conjunctiva pink, the sclera white, her pupil, I don't see any cloudiness on her cornea, and her iris is well defined, and her lacrimal gland is intact or patent. And then we can do we'll do the visual acuity, which is cranial nerve 2. We would do that. We can't do it in this video because of the space, but we would use a Snellen chart, and she would be 20 feet away from it. I would point to a letter, and she would read the smallest line of print possible, and that would tell us her visual acuity. And we could also, that's for distance vision, and then we can also do near vision. It's the similar chart, and it would be 14 inches away from the patient. We can do, the confrontation test, and that's your periphery. So if you'll cover one eye, okay, and you tell me when you see my fingers in your line of vision. Okay, and then another time. Yep. Okay, perfect. And then if you'll do we can do the cover, uncover test. So if you'll cover one eye, and then take it off. Okay, and then the other eye, and take it off. There's no deviations present. We can actually look at her reflex and her pupils at the same time. So I'll go in with the light and look at her reflex. Just present on both. Her corneal light reflex and her pupils are equal around. They're measuring at 3 millimeters, and they're both reactive to light and accommodation. With all of that, with those few tests, we've assessed cranial nerve 2, 3, 4, and 6. So with this, we'll do your ophthalmic exam next. And then if you'll just look over my shoulder towards the wall, okay? And I'll look. So we're looking for at the lens, the retina, the retinal background, the optic disc, and the macula and fovea. And we're looking at the blood vessels throughout. And we would do that bilaterally as well. Okay, so from the eyes, we can move on to the ears. So we'll start with hearing first. So we'll do the whisper test to begin with. So if you'll cover your right ear and repeat what I say. Dog. Good. And we would do that bilaterally as well. We can do the Weber and Rhine to assess cranial nerve 8. So we'll do Weber first. You tell me where you hear this. On both sides. Okay. And then we'll do the Rhine. So I'm going to hit the tuning fork. I'll place it behind your ear, and you tell me when you don't feel it anymore. Okay. You still hear it? Okay. So ear conduction was longer than bone conduction, which was normal. We can then inspect the external ear. You do this bilaterally also, so I don't see any deformities or abnormalities. We can palpate any tenderness. No, and I don't feel any nodules. We can look at the middle ear, so I'll pull the pinna up and back. I'm lying on the open side. No redness, no swelling. Don't see any foreign bodies. The cerumen is light yellow and thick. You want to make sure that you can visualize the tympanic membrane and malleus, which I can, and I didn't see any air bubbles, any bulging, and no fluid. So from there, we can move on to the nose, and we'll inspect first. It's symmetrical. I don't see any skin discolorations or abnormalities. And then we can look inside, same thing with the lights. If you'll tilt your head up, mucosa is pink and moist. I don't see, or patent turbinates, and I don't see any perforations or septal deviations either side. You would then palpate the outside of the nose, the upper third, the bony part. Any tenderness? No. Bottom 2/3 is cartilage. Any tenderness? No. Okay. And we can do her sense of smell while we're here. So if you'll cover one there. It's not. Do the other one. So good. Okay, so that's cranial nerve 1. From there, we can move on to her neck. We'll move on to her mouth. Okay, so let me get the pen light. Okay, so I'm looking at the external mouth. Her lips are pink and moist. I don't see any ulcerations. I don't see any cracking. And then if you'll open your mouth, looking at her teeth, I don't see any that are abnormally positioned or discolored. I don't see any that are missing. Buccal mucosa is 1 moist and pink. Her gums have good margins. I'm also looking at her tongue. It's symmetrical and pink. You'll lift your tongue up, looking underneath it. No nodules or ulcers that I can see. And tongue movement, if you'll stick your tongue out and move it side to side, okay, that is cranial nerve 12. And then if you'll open, extend your tongue, say ah. Okay, so I'm looking at the back, posterior pharynx, no tonsilary enlargement. Her uvula and soft palate rises midline, and that's cranial nerve 9. And you could use a tongue depressor at this time to do cranial nerve 10 to see her gag reflex. So from then, we can move on to neck. And we'll inspect first. I don't see any, it is symmetrical. I don't see any scars or masses. We can do your neck range of motion, so if you'll tilt your head down and tilt your head back, and then lateral side to side, and then rotate. Perfect. And then we can palpate, and any tenderness? No. Oh, and her trachea is midline. We can also palpate her thyroid, so I'll feel here and you swallow. But no nodules in her thyroid, and it is mobile. So from there we can move to respiratory, and we'll start on the posterior chest. So first you're inspecting. You can also look for spinal deformities here. I don't see any muscle retractions. I see equal chest movement, symmetrical chest movement. Good skin integrity as we're looking at skin throughout. You can palpate. Any tenderness? No. No tenderness. I don't feel any palpable skin abnormalities, and I don't feel any spinal deformities. From there, I can do, we'll do chest expansion. So my thumbs are at her 10th rib, and you'll take a deep breath in and out. Equal chest expansion there. We can do tactile fremitus. So every time I move my hands, you say 99, okay? 99, 99, 99, 99, 99, 99. Okay, symmetrical fremitus and no crepitus noted. We can percuss next. We'll start at the top in a ladder-like fashion and go down. Okay, resonance heard throughout the lungs, and then I'll auscultate. Just some deep breaths. Breast cells are cleared equal bilaterally. Also percuss for CVA tenderness of the 12th rib. So tenderness? No. Tenderness? No. No? Okay. And we'll go to the anterior chest. So same process when we're inspecting. I don't see any muscle retractions, no increased work of breathing. I don't see any thoracic deformities. See equal chest expansion and appropriate respiratory movement. We'll then palpate, so if you feel any tenderness, no, and I don't feel any skin abnormalities. And then we can do chest expansion, same thing, lateral sides of the ribs, deep breath, good, equal chest expansion. And then we'll do tactile fremitus, so the 99 again, so 99, 99, 99, 99, 99. 99. Good. So symmetrical fremitus and no crepitus noted. And we'll percuss first before we auscultate again. Same thing, top to bottom in a ladder-like fashion. Okay. And resonance heard throughout. And we'll listen again. A deep breath. Okay. breast sounds are clear and equal bilaterally. And from there we can move on to cardiovascular. So same thing, inspect. I don't see any abnormal skin color is good. You're looking at skin also throughout this. No cyanosis. I don't see any abnormal pulsations anywhere. And then we can palpate the cardiac points, so aortic, pulmonic, point, tricuspid, and mitral. You can also palpate at the apical point, and I don't feel any pulsations. You can also do that with him laying down. I don't feel any heaves or thrills. Palpation, and I'll listen. In a normal assessment, you would listen directly on the skin with the diaphragm and the bell, and we'll listen with you sitting up and then laying down, okay? Now I'll get you to lay down, and we would listen with the diaphragm and the bell. And you can palpate at the apical pulse again, see if you feel any pulsations. I don't. Okay. And then, we can also palpate her carotids one at a time. And you're also able to look for jugular venous distension, which I do not see on her, and that would be at 30 degrees. So, next we'll go to abdomen. We'll inspect first. You're looking for good skin integrity, contour, no pulsations. Then we'll listen. We'll listen to your bowel sounds first. Oh, looking for any indurations. That's what it was. We're listening to all 4 quadrants. You can also listen the epigastric area for the aorta. You listen for with the bell. You can also listen for the femoral artery. After that, we'll percuss. We'll do all 4 quadrants. And we can do the left upper for spleen, right mid-clavicular for liver. Then we can do light palpitations, so feeling for any tenderness. The patient will let you know. You also look for their facial expressions. We can do, from there, deep palpitation. We can do the epigastric area to feel the aorta. We can do all 4 quadrants as normal. Do left upper for spleen. Do right mid-clavicular for liver, and then right upper for kidney, and then left middle, and left upper for the other kidney. And then you can do the abdominal reflex, and you just take something. We'll go from each side inward to look for umbilical retraction. So from there we can move on to the breast. So if you'll, and it's a good time to teach your patients about self breast exams. So she's got her arm up above her head and behind her neck. So first you would inspect, make sure the appropriate size, appropriate symmetry. You want to look in 2 different positions, and then then you'll start by palpating the axillary lymph nodes, feeling for any enlargement or tenderness, moving to the outer area of the breast and to the inner in a circular motion. You'll also feel the nipple, the areolar, and the subareolar areas. That's it on that. And then from there we'll move to musculoskeletal. So while you're laying down, we'll go ahead and assess your hips. So they're symmetrical. You can palpate inguinal nodes and femoral arteries. You're looking for a 2+ femoral pulse. We want to do your range of motion. So if you lift your leg straight up in the air, good, and down, and then extend out, good, and then cross your leg, perfect. So hip range of motion is good. Then you go to the knees. You're looking for any redness, swelling, and then you'll palpate for any tenderness, any deformities. You can also palpate the popliteal pulse while you're here. And it is a 2+. And then if you'll bend your knee all the way up, and we'll do your range of motion, good. And then you can do down, down. You would do both of those bilaterally. Move to the ankle. You're looking for any deformities. You're looking for any redness, edema. You can palpate any tenderness. No, I don't feel any deformities either. And if you'll do your range of motion, so towards you, point down, point side to side, and then rotate. Good. And you do that bilaterally as well. And check her cap refill. It's less than 3 seconds. You can do her toes. You're inspecting them, palpating them as well, and then she can wiggle all of her toes. So that's her range of motion. It's intact. And then you do that bilaterally as well. So if you stand up or sit up, we'll do your upper extremities, starting with your shoulders. You would look for symmetrical. Look for any skin abnormalities. You can palpate for tenderness. Yeah, feels like normal alignment. While you're here, you can also do cranial nerve 11, which is the shoulder strokes. Good. And then another one is the facial. You'll push towards me. Good. And then push towards me. Good. Okay. And then shoulder range of motion. So if you'll lift your arm straight up, and then one arm behind you, and the other arm behind you, and then down, and then back, and then touch your back with that hand, then the other one, good. And then shoulder to shoulder, good. Then we'll go to the arms. You're inspecting the arms, hair distribution, redness, swelling, any deformities. You can palpate. You're feeling for any tenderness, any deformities. Nope. You're also assessing her muscle mass, and you can do the range of motion here. Well, you can do the range of motion. So if you'll squeeze my fingers, good grip strength, and then bend and pull towards you, good, and then push towards me, good. Muscle strength is a 5 out of 5. We can go to the elbows. We can palpate, and you're inspecting them as well when you do the arms. If you can bend your elbow, yeah, good. Range of motion is good. You can turn arms like this, good. And there's no crepitus noted as well. We'll go to your wrists and your fingers. You're inspecting them first. Her nails as well. It's good color, no edema, no redness. You palpate for any tenderness. Nope. No tenderness. You can also palpate her radial pulse while we're here. That is a 2+. We can do range of motion of your wrist, so point down and up and side to side and then around. Good. And then your fingers, so you'll go like this, spread them out together, do a fist, and then back towards here. And you can push out, good, resistance, and then hold them out, and then push out, good. Then we'll move to neuro. Next. Start with if your patient is alert and oriented, which we said before, but you probably would get that in the health history and just by talking to them. But we'll ask anyway. So what's your name?
Madison.
My name is
Mahaley.
And where are we?
Coleman, Alabama.
Yes. And what is the month and year?
January 2020.
Good. So she is alert and oriented ×3. We can do her reflexes next. So we'll do her triceps. So if you'll just put all your weight on me, just relax. Okay? And then we'll do biceps. So you will relax your arm on me. And we'll do radial. So just put it down and then patellar. And then we'll do Achilles. Okay, and then the Babinski reflex is negative. Next we can do your sensation. So if you'll close your eyes. Okay, so this is soft and this is hard, okay? And so you tell me when you tell me what it is.
Soft. Soft. Hard. Soft. Hard. Hard. Soft. Hard. Hard. Soft. Soft. Hard.
Okay, perfect. Next, if you close your eyes and hold your hand out, I'm going to put an object in your hand and you tell me what that is.
Paperclip.
Perfect. From there, we can do your motor. So I'll hold my finger out and you just touch your finger from my finger to your nose. Perfect. And you would do that bilaterally. And next, we'll get you to stand up and we'll do the Romberg test. So if you'll put your arms out and then one foot up and then close your eyes. And then I'll test your balance, which is good. Next, we'll have you, you're good. Next, we'll have you walk in a straight line across the floor. And then walk back and heel to toe. Perfect. And that completes our head to toe physical assessment.